Hello everyone. Today we have Mr. Raghav, and he had a procedure almost a month back. So he just completed 1 month. Currently he is in the shedding phase, though in his case the shedding is very minimum, but still sometimes it happens. And as I remember, before the procedures, you had some concern, you had some side effect, you had some apprehension even the one day before the procedure. So, can you briefly give us some about you, like about your hair loss journey, and how you decided to go for hair transplant procedure?
So I started noticing visible hair loss around 4 years back. And of course, it impacts your confidence a lot. You start going out less and all of that. So I started researching. The hair transplant is a big surgery. So I was a little afraid. I was very scared. One day before, as doctor said, I was very scared to get the transplant. I was like, how painful will it be? Will there be any side effects? Will I face a lot of swelling? What will happen? Because you see pictures, you see videos on internet. But
Yeah, there are a lot of information these days.
Yeah,
Some are fact, and some are also not.
some are not true.
So very scary also.
Yeah, true. So I asked doctor a lot of questions and he cleared all the queries, and ultimately I went for the surgery. And honestly, one of the best decisions probably till now, because minimum pain, very less pain in fact. And
So if I'll tell you like a grade from 1 to 10, so where you'll put the pain level?
the pain, I think 2, 3, that's it.
So this is very minimum.
Yes.
Pain is mostly when we do the anesthesia.
Yeah.
And after that, and the whole process, you won't feel anything. Sometimes you may have a little bit of sensation.
Yeah.
And after that, you are on medicines.
Very easy. I think the first 2, 3 days, just a sleeping position. After that, it's all good. It's all easy. And like you can see, it's all clean. It's all easy now.
So any side effect, anything you noticed in last 1 month during the recovery phase, or any extra precautions you had to take, or anything that restricted your normal day-to-day activities?
Not really. Only, as I said, only the first 2, 3 days, there is a little swelling. So you don't feel like going out. You don't feel like seeing anyone because your head is a little swollen. But otherwise, it's all good. Only direct sunlight I've been avoiding. So otherwise, everything is fine.
So as I said in the previous first, so the shedding is normal. You're just 1 month. It's about just beginning of your hair restoration journey. So at 1 month, we're expecting a bit more shedding, but in your case, it is very minimal. That sometimes happens. Some people start shedding later, but we have still 2 months time frame. So till 3 months is the shedding. But sometimes what I've observed that my shedding is minimal, and maybe 10%, 20%, then they start growing directly. So this is more related to your scalp condition. So these are more resilient, so that grafts have grown directly. And sometimes it's also related to technique. Like in our cases, we do direct hair transplantation, the simultaneous extraction plantation. So as the out of the body, the timing is very less. That also sometimes helps in preventing shedding and also early regrowth, right? So initial 1 month is a more crucial in terms of post-care maintenance. And if you'll see, this part is almost full. And the donor was also here. You had a medium density donor. So that, and also it's some feature of retrograde thinning. So that's how we decided to do this grafts only the front mid area. So that we are making sure we are taking grafts only from the healthy area, right? So, and crown is the area which respond better to the medication. You are in a stage where still good amount of existing hair. That's why I kept that area for medical management. We'll review after a year, and we have planned in a way you have good amount of reserve in the donor. If you'll see the donor area, it's not very visible or over extracted. So in future we have good reserve for the scalp. Again, you have good beard. So if needed, we can plan for a second sitting in later. But I think with medical management and also you had some phobia regarding side effect getting finasteride and all, if I remember. So can you give some point, because a lot of people have fear because there are a lot of stuff in the internet like post finasteride syndrome, infertility. So just give your experience, like you have started the low doses that you have suggested, so that you are personally convinced you are not getting any side effect.
Yeah.
So can you give some comment on that?
So, as doctor said, I started with low doses, and I'm still, gradually increasing, because as doctor said, we will be taking it slowly so that we can see if there are any side effects. I have not suffered any side effects yet, not from the surgery, not from the medications, anything. So, I think it's a good way to start to see, to notice if you feel anything, then only you increase, or you do not increase. But I'm sure even if you don't, then we have other
Yeah, so that's why because like I said, like in 100, in Indian population, 2 or 3 may develop side effects. So we're not sure in 2% or 98%. So majority is 98%, right? So the thing is, the transplant rate here doesn't need any support, any additional support. Is for your existing hair. So if with the least dose, without side effect, we can prevent another surgery, it's a good idea to give a medical support. So thank you for your honest opinion.
Thank you so much.
And so we'll be in close monitoring till the 1 year, till you get the desired result.
For sure.
And thank you again for choosing Alloroots.
Thank you so much, doctor. Thank you.